Oral cancer is an increasingly common problem in veterinary patients. In fact, the oral cavity is the fourth most common place to find cancer in dogs and cats.
Here is a picture of an acanthomatous ameloblastoma in a dog. This is a picture of an aggressive fibrosarcoma in a dog. Don't let the small size of this growth fool you. It is actually a very aggressive cancer. Early detection and surgery saved this patient's life.
Southern California Veterinary Dental Specialties is uniquely equipped to best treat oral cancer in dogs and cats.
We have the latest in digital dental radiographic technology. Our direct sensor system gives us immediate, excellent images. For larger masses, we have a ScanX system, which has excellent quality with a larger film size. Finally, we have specialized surgical packs for major oral surgeries.
In addition to all this specialized equipment, I have over 13 years of experience working exclusively within the oral cavity. I have exhaustively studied the anatomy and physiology of the oral cavity as well as the pathophysiology of oral cancer. I am uniquely trained in treating oral cancer within your pet and can provide the best therapy. As soon as any lesion is noted, it should be brought to the attention of a qualified veterinarian. Watching and waiting is not a good option. As soon as possible, a biopsy sample should be taken and submitted to the lab to determine what the lesion is. At that same time, we recommend a dental x-ray be taken to determine if there is any bony involvement.
Here is a picture of a normal lower jaw in a dog. Note how the bone fills up the furcation, or area between the roots, and comes up to the neck of the tooth. Here is an x-ray of a fibrosarcoma in a dog. Note the dark area, which is shown by the arrow, which is where the bone has been destroyed. This is an osteosarcoma of the upper jaw. This also shows severe bone loss. Here is a radiograph of a cat with squamous cell carcinoma. Note that it involves pretty much the entire lower jaw.
Oral cancer in cats is an increasingly common problem. By far and away, squamous cell carcinoma is the #1 diagnosed cancer in the mouth of cats, followed by fibrosarcoma and melanoma.
This is the typical appearance of a squamous cell carcinoma in a cat. Notice the severe inflammation. Here is the radiograph of the case revealing significant bony destruction.
Unfortunately, the only treatment for oral cancer in cats is early aggressive surgery. By aggressive surgery, we mean 2 centimeters of margin all the way around the tumor. Unfortunately, it is rare that cats have enough face to achieve this. Therefore, early detection, meaning regular oral exams by you and your veterinarian, are necessary to do this. Once we have amassed all the necessary information, the biopsy report, the dental radiographs, plus or minus a CAT scan or MRI,
you and I will decide proper therapy for your pet.
And then, as soon as possible, we will implement that therapy. Oral cancer is an increasingly common problem in dogs, and growths can range from anything being very benign, such as gingival hyperplasia or an epilid, to more aggressive growths such as an acanthomatous ameloblastoma, a fibrosarcoma, or a squamous cell carcinoma, and the worst of all, a malignant melanoma. Proper therapy for these different oral masses are quite varied, and therefore definitive treatment prior to a biopsy is not recommended. Small gingival growths, or epulids, are very benign proliferations of the periodontal ligament. However, they can get quite large.
This photo shows a large epulus. While it looks very scary, it is actually benign and can be treated easily. The dental radiograph reveals no evidence of bony reaction, which is an indicator that it is not a bad tumor.
Treatment for these is generally to cut them back to physiologic margins. If they regrow quickly, then you must remove the tooth and the periodontal ligament that is creating them. Moving up the ladder of aggressiveness, the next step is the acanthomatous ameloblastoma. This is very common in the incisor region of dogs. This tumor, while very aggressive locally, does not spread. or metastasize. Treatment for this tumor involves excision of everything you can see clinically as well as radiographically and 1/2 centimeter of margin all the way around the tumor. Another option for treating very large amelioblastomas is radiation therapy, which is reported to have a 90% control of tumor rate. However, most oncologists recommend surgical removal of any tumors that are amenable to that. Squamous cell carcinomas and fibrosarcomas are more aggressive than acanthomatous amelioblastomas. They easily invade soft tissue and bone. However, they metastasize only late in the course of disease. Because they send out little microtendrils of tumor cells into the bone and soft tissue, they require a 2-centimeter margin all the way around the tumor that you can identify clinically and radiographically. This results in a very large surgery in certain cases. Radiation therapy can be used for palliative control. However, it is not a cure in most cases. Chemotherapy is unfortunately also ineffective for these tumor types. The most aggressive oral tumor in the mouth of dogs is a malignant melanoma.
This is the typical appearance of a melanoma in the mouth of a dog. Note the dark pigmentation of the growth. However, not all melanomas are dark. This is an example of an amelanotic melanoma. Treatment and prognosis are the same for both tumor types.
These are not only very locally aggressive, they also spread like wildfire. 90% of the time, by the time it's diagnosed, it has already spread. Treatment for malignant melanomas consists of surgical removal, again, 2 centimeters of margin all the way around the tumor, radiation therapy, chemotherapy, and possibly a vaccine. Unfortunately, the long-term prognosis for most pets with melanoma is very poor, generally around 9 to 12 months at best case scenario. As you can see, the major therapeutic option for oral cancers is surgery. These are typically termed mandibulectomies or maxillectomies and are typically fairly large surgeries. Many clients are concerned with the functional and cosmetic effects of these aggressive surgeries. However, I assure you that in most cases, the patient does not mind. Therefore, most pets will do very well postoperatively, and this should be considered if the tumor is operable.
This is a post-operative picture of a maxillectomy performed for a squamous cell carcinoma. As you can see, it was a very large surgery. However, this is the 1-month recheck picture. As you can see, the patient looks almost completely normal. This is a postoperative image of a mandibulectomy where we had to take the lower jaw back to just behind the canine teeth. Here is the same patient 2 weeks postoperatively. He is acting normal, is very happy, and cancer-free.
Since complete resection of the tumor is the typical treatment for oral cancer, early detection and treatment is critical to a positive outcome. However, there are other options, and we will work with the specialists at California Veterinary Specialties and Veterinary Specialty Hospital to come up with the best treatment plan for your pet.